All right, well, hopefully others will join soon, but I'm going to welcome to the podium Dr. Emmanuella Salia. She's an alumni of this conference 2018, so many years ago. I'll let her do further introductions of herself and why she's here today, but she's going to speak to us about the power of networking and mentors.
I think I'll just get started and then have other people come in, but I'm really grateful to be here today and for this opportunity. Please pardon my voice, I have a cold and so it's fine. Thank you. So today I'm going to be talking about something that I'm very passionate about, which is networking and mentors, and just to highlight the power of the people that we have around us. I'm a third-year pediatric resident at Mayo Clinic, and I get to work with some of the amazing faculty that we have here. I want to start by saying that I'm definitely not an expert in this area, and as some of you were in the alumni session yesterday, it's still something that we all are getting more information and trying to improve in so many ways. My hope with this presentation is that you will probably realize that you are doing most of the things or some of the things, but just being intentional about the things that we are doing, and hopefully you learn one or two new things that you can put into practice as you go back and you can share with other people. Okay. So I think that the people around us, you look around you and they are one, or I would say the greatest resource that we have. I know we have capital resource, financial resources, but people really are your greatest resource, and they are a depth of knowledge. With medicine being such a multidisciplinary and interdisciplinary field, it's very important that we realize the importance of sharing of knowledge, and this is why I think that having mentors and networking across the globe in this era of the world being a global village is very important. And yesterday we also learned that networks and having relationships with people, or a social network, is also one of the positive, the risk factors of dementia. So I think we have so many reasons to have these connections and to continue to grow them. Okay. When we think about mentors and networking, I see it really to be an interplay between the two. And we'll understand a little bit and further down the presentation, because you can see that through your network or through networking, you are able to be exposed to many more people, and you are able to make those connections, some of which will potentially become mentors. And as you develop the relationship between yourself and your mentor, that mentor invariably also becomes a resource to help you even be more efficient at networking. So it's kind of a dynamic interplay. Okay. So a little bit of history. The concept of mentors dates back, way back, under Greek mythology, and it's said that there was somebody called Telemachus who was Odysseus' son, and as he was going to war, his dad put him in the hands of somebody called Mentor to guide him while the dad was at war. Unfortunately, that person was not able to play the role effectively, and so the goddess Athena stepped in and played that role. And so even from an early stage or from its origins, you can see that sometimes mentorship doesn't really go the way that we expect, and it's totally normal for you to pivot and find someone else or a more suitable mentor. So I don't know if anybody knows who this is. Sorry, I thought somebody said it. You can be bold. This is Socrates. And Socrates was said to be the mentor to, do you know who this is? Plato. Plato is this, and he was also a mentor to this last person. Yes, Aristotle. Good. So you can see that it's really a progression, and as my hope is that at the end of this presentation, as we learn how to find suitable mentors, the ultimate aim will be that you be inspired and aspire to yourself, become a mentor to somebody else, because you are all very capable of that. Okay. So we have different forms and types of mentorship. In a broader sense, you can say official or unofficial like mentorship category, where the official one is what you would is more structured, and so maybe in your medical school or residency programs you are assigned a mentor as a result of your interest or your stated goals, and you are assigned somebody who's dedicated to play that role. And then you can also think about it as unofficial, where you seek out mentorship, where you through your networking and other interactions with people, you're able to find somebody who can play that role. The mentorship can come on an individual one-to-one level, and then it can also be like a group or team dynamic. And that can be helpful when you have a mentor who is has very little time but is willing to do so in a larger group setting, right? And then we also have peer mentors, where you have somebody who is almost at the same level. When I think about mentorship, we usually think about it from like a vertical approach. So somebody who is higher than, I won't say higher, but somebody who has more knowledge or more skill sets and is able to help transfer those skills to you through the mentorship. But then also on a horizontal plane, among peers, you can have somebody who is potentially at the same level of training as you, but is able to offer that kind of peer mentorship in an area where the person has more skill sets than you do. Okay. And so, as you can tell, there are advantages and disadvantages to all these kinds, and you have to figure out what works for you as an individual. We've heard so much about being self-aware, knowing yourself, knowing who you are, knowing what your purpose is and what your strengths are. And so all that will help you identify the kind of person you are. Are you somebody who thrives or works better when you are in a group mentorship session where you are hearing other ideas from other people and bouncing them off, or you want that one-on-one? And the fact that you are in one doesn't preclude you from having others, as we'll come to see. So how beneficial is having a mentor or being engaged in mentorship activities? There have been many studies that have shown across board, all the studies I was looking at, more than 70% of people would say mentorship has benefits to them. There's definitely a number of people who have had potentially not very pleasant experiences with their mentors, and so as well they don't think it's a good idea. But by and large, majority of people would admit and agree with the fact that mentorship is important. For young health professionals like ourselves, we know that coming out of a medical school and just coming into the workforce can be overwhelming sometimes, and so we are at higher risk of burnout, we are at higher risk of having difficulties transitioning from the trainee landscape to more independent. I know house job, you are supervised, but then as you continue to go up, you become a medical officer, you become a resident, your responsibility increases and your independence continues to increase, right? And as we heard again yesterday, I know some of you were at the alumni session, there's a lot of competing interests that we potentially need help navigating. So your mentor will be somebody who will really help you with goal setting. And goal setting is very important. And being able to come up with specific, measurable, attainable or achievable goals, relevant goals which have time-bound aspects to them. And in the time-bound aspect, the mentor also serves as a form of accountability, because this is somebody that you are engaging with and you are building a relationship with, and you are keeping account of the things that you are both learning and the skills you are practicing, and how that is really changing your professional identity and your personal development, which are the main goals of mentorship. Okay. So the mentor will also help you, like I mentioned, with networking, creating opportunities, sharing some of those opportunities, and potentially even giving you access. So there's many terminologies that are around. There's like a coach, there's an advisor, there's a sponsor. All these terms, when you are reading about mentorship, you might see them come up. By and large, they are similar, but the responsibility and the interaction between the mentor and the mentee can look different in all these situations, but sometimes they are used interchangeably. It's been shown that the quality of life of individuals who have mentors or trainees who have mentors is by far better than trainees who do not have mentors. And that's because job satisfaction outside even of medicine, like in the financial world, in the fashion industry, mentorship is something that is highly valued and has been shown to increase job satisfaction, to reduce burnout and fatigue, like we heard this morning, and to also provide psychological support for younger professionals. And then importantly, there's a lot of knowledge sharing that happens with mentorship. Okay. I have this poll that I would love for you to fill out. So if you can just scan the code, the QR code. It's anonymous, so we won't know who is saying what. But I'm just curious, what, in your perspective, makes finding a mentor and or maintaining a mentor-mentee relationship challenging? So we know that when we find mentorship, it's really establishing and maintaining the relationship. So there can be challenges with establishing that relationship. There can also be challenges with maintaining the relationship. So I'm curious what your thoughts are. Okay, one person is typing. That's really encouraging. Because of time, I'll wait for, okay, wonder if they have time to mentor me. Thank you. So time is one thing. Anybody else typing? One more person. After this person, we'll just go on. There are some other questions. So, are you having challenges? Oh, it's asking you to log in. Oh, I'm so sorry about that. Then who was able to write this? Okay, so would somebody like to say some of the things that were on your mind that you were going to type out? I'm so sorry that it's not working for you. Do you want to share? Okay. All right, I'll go on. There are some questions also along the line, so I'll probably just be asking for your participation if that will be easier. Okay. So some of the things that came out really were time constraints, like somebody mentioned, not knowing where to start. I don't even know how to find a mentor. I don't know like what that relationship looks like. And then some people say, I'm very introverted, I'm very shy, I don't know how to maintain that relationship or go out and find somebody. And then what if the person I find isn't the right person? And so this is not a marriage talk or anything, but I think it's very similar to like dating or finding a spouse. And so the thing about it is that time will tell if the person is the right fit for you, right? And so it's very important not to put too much pressure on yourself. Things will kind of play out like we had. And once you're putting in the right effort and putting in the time and the things that you need to develop that relationship, then if it's a beneficial or suitable match, you'll be able to tell. Okay. So how do we navigate finding the right person and maintaining that relationship? The first thing is that, as we mentioned, your mentor is going to be somebody who will help you in goal setting, right? And having those SMART goals. having those SMART goals. So it means that even as you are going to have that expectation from your mentor, you have to go in knowing, having a specific ask. We have different kinds of mentors. You can, in the medical space, outside of medicine, you can have a mentor for finances, for parenting, for whatever it is. But in the context of what we are discussing, you can have a mentor who is more research focused, helping you with research. You can have somebody who is more clinical, so helping you with your clinical acumen and just being a better clinician. You can also have somebody who is helping you, thank you so much, thank you, who is helping you with your leadership role or whatever it is in the clinical setting. And so you have different asks that you'll be putting forward to these individuals. So knowing exactly what it is that you want from that person, because without expectations, there's bound to be disappointment, and you'll say that that person wasn't a match because expectations were not clear from the beginning. The second thing about it is that consistency. In consistency lies the power to anything and most things. And so being consistent in building that relationship, investing time and investing what you give is what you get. So it's like garbage in, garbage out. Like any relationship, if you are not spending time with the person, or you are not making the effort to get to know the person as the person gets to know you, that relationship is not going to stand the test of time. I know that the virtual space brings a lot of opportunity for us to network and find mentors in the virtual world, and there's also a lot of value in having face-to-face interactions. Okay. The third thing that's very important is to know your capacity and know what you are able to put in to be able to get the results that you want. And so, for example, if you have many competing interests, which one is a priority to you at this stage in your career development or your professional identity formation? Is it research? Is it clinical, a clinical mentor you are looking for? Is it more communication, somebody who can help you, or presentation? What is it that is most important to you? Then you can, prioritize and expend the energy and the time that you need to be able to get the results that you want. You have to be respectful of that individual's time, and you have to come to your meetings prepared. Come with questions that you can ask to be able to get the answers that you want. Make sure that you have periodic times for assessing and evaluating the relationship that you are forming and seeing whether it's in line with the expectations that you set out right from the beginning. The third thing is, along the lines of capacity, you should know yourself. So there's a saying that to thine own self be true. So you know yourself, you know what it is that you want, you know what it is that you can handle in a time frame. And when those expectations are communicated clearly to your mentor, that mentor very likely will also communicate their expectations to you. And in the absence of that, I would strongly recommend that you be an advocate for yourself and ask the person, these are the things that I would like you to help. Are there any expectations that you have of me? So that can be clearly established right from the get-go. This concept of reciprocity is one that is a little bit tricky, because most of the time as young professionals, we feel like we don't have anything to offer the person. And so it's like, as a young doctor, what is it that the person is pouring into me, but there's really nothing that I'm giving back to the person. And I want you to understand that it's really not grand things or extremely big things that I'm proposing. But when you think about relationships where it's more of a parasitic relationship than a symbiotic relationship, this is back all the way to biology, but permit me, you realize that when there's like a bi-directional flow of information, something very simple as you come for your meetings prepared. So today you want to talk about, say, implicit bias, or you want to talk about imposter syndrome, or something that you want to find out from the mentor how to navigate these things. You come having read or done a little bit of background reading, and even sharing the information that you have read and things that you have come up with, and asking them their opinions. So for example, you say, implicit bias, we heard a lot about it yesterday. I was looking online and I saw maybe like a Harvard Implicit Association test. Is this something you are familiar with? Is this something that you know about? Just that alone, your mentor may or may not have heard of it, and that can be an opportunity for you to also share your knowledge with that person. So simple things, it doesn't mean you have to, you necessarily are giving that person advice, but even sharing of information. One very important thing that mentors have appreciated is having their mentees give them progress reports at intervals to show that the time that they are putting in and investing in your growth is actually time well spent. And so a simple email 2 or 3 weeks after your initial conversation, just giving a follow-up that, oh, you talked about A, B, and C. I put this into practice. This is what I'm seeing. These are my next steps. Alone is enough for the mentor to feel a source of, feel as if they are doing something. They're actually making an impact, because most of them want to make an impact in people's lives, and that's why they are doing that. So I want you to know that you have something to offer at every stage in that relationship, and so it's not just like always taking, but also making a conscious effort to also give to that person. Then this was going to be another question, but since the slide was not working, I'll just, by raise of hands, do you know has anybody heard of an elevator pitch? An elevator pitch? Okay. All right. So I was just going to share this concept of the elevator pitch. So I want you to imagine that you are in a restaurant or a hotel, and you're on the first floor going up to the 3rd floor. You press the button, the door opens, and in there is standing somebody that you have always admired. Anybody that you have really wanted to build a relationship with or get to know, a famous person, anybody. So it can be President Mahama, it can be Barack Obama, anybody. Just imagine. And you get onto that elevator, you have from the 1st floor to the 3rd floor, maybe 30 seconds, to have a conversation with that person, with the hope that after the conversation, the person will probably give you their card or be like, oh, this is my information. I want to continue this conversation with you. What would you say? What would you say in those 30 minutes? 30 seconds? Does anybody want to try? What would you say? The first time I did this practice, you want to try? Okay. I don't want to put anybody on the spot, so it can be very nerve-wracking, and you think you have something that you want to say, but at the end of the day, you open your mouth and you're just like frazzled and you don't really know what to say. So this concept of an elevator pitch is especially for those of us who are more introverted, we don't really know how to interact or start conversation. So you think about who you are, what are the things you are passionate about, and what is the ask that you have of that person to be able to continue those interactions. So for example, let's say Gideon. Gideon can say, my name is Gideon, I'm a first-year emergency resident who is interested in POCUS and advancing POCUS in low-resource setting. I'm interested in connecting with you to learn more about you. Let's say he's meeting Dr. Homi. So he says, I'm interested in learning more about your approach to capacity building relating to POCUS in Ghana specific. Less than 30 seconds, you have it down, and then now you've given that ask to the person, and hopefully the person knows who you are very briefly, knows what you're passionate about, and would want to engage even more. Okay, so that's one thing that you can do, and this can be very helpful in conferences, even like this. You can start trying it out when you are having lunch or at dinner or around. You see somebody and you just try it. Right? It might take a little bit of refining to try and get it down, narrowed down to what your particular interests are. So just to talk a little bit about networking, I think it's a little bit very broad, not a little bit, it's very broad, but just a few highlights. Start where you are. You have people here, like I said, they are your greatest resources. The person sitting next to you knows somebody who is interested in something you are interested in. And unless you talk to that person, you will never know. There are some formal mentorship groups that are available in different schools. I'm not very sure, maybe you can talk amongst yourself from your medical schools what is available, even among like the Medical Students Association and groups like that, as well as Young Doctors Association, those in residency. They have some formalized groups that you can engage in. And in those groups, we have people who are interested in mentoring. So you have mentors who are hopefully interested even in learning how to be mentors, because it's a skill set that you need to continue to refine. There are professional organizations that have annual general meetings and other conferences periodically that you can always look up. So because I'm in pediatrics and interested in neonatology, I would have been a little bit narrow in that. Like we have TCAN that you can join, other groups. So whatever your interest is, you Google is your friend and just talking to other people as well who are interested in what you are interested in, and they can help you with that. When you go for these conferences, you need to also be very intentional about coming out of your comfort zone, talking to people, simple things like we've discussed, this elevator pitch, you can use it with people, just learning really about what people are interested in, and through that you can make connections. Then the last thing I want to highlight is engage. When there are opportunities to volunteer, those are excellent opportunities to get to meet people, to know what people are doing. It's important to engage. You might be scared doing it, but do it anyway. You might be uncertain about how things will go, but do it anyway. Because like we heard yesterday, opportunities come sometimes once, and it will take a while before it comes again. So when you have the opportunity, take it and then just go with the flow. It will be fine. You really will be fine. Jeffrey, did you want to try the elevator pitch? Okay.
Hi, my name is Jeffrey Park. I'm a medical officer, and I work at the Common and I'm deeply interested in pediatrics with a subspecialty interest of cardiology and specifically adult congenital. So this is the picture of the and I know that I've been keenly following your work in pediatric cardiology, especially congenital cardiology, and I've been fascinated by what since I was in medical school. I would like any opportunity to collaborate or work out with you to be able to align my career goals in the way that I always desire.
That's a very good. That's a very good try. I'm sure the elevator will be on the 5th floor by now, but but that's fine. So just learning how to like continue to refine that, but that's a very good start. Definitely something that we should all try and just continue to refine. Okay, thank you so much for volunteering. So in summary, I want you to go away remembering that mentorship is a relationship that requires some level of effort in establishing that relationship, but also in maintaining the relationship. And so if your mentor, for example, says, I can meet you every 3 months, take that and be consistent at it. Meeting every 3 months, you can always send interval, emails, updates in between those 3 months. There are some situations where your mentor, it's like, I'm so sorry to be using dating examples, but I can't think of any other example, but you really want to talk to this person, and the person just is so busy and is not minding you, and says, I can only talk to you on once a year, right? You really know what it is that you want that relationship to look like. So you take what you have and then you start working towards increasing that face time with the person. It's very important that in mentor-mentee relationships, the quality is very important. So if you are meeting somebody once a year, but that once a year meeting has so much value, then I think I would argue that it's a good thing to take up rather than meeting every 2 months and the quality of that meeting is not very much what you were expecting. Okay. So start where you are and be prepared to move out of your comfort zone in this whole networking and mentorship field. Aspire not only to be a mentor, but also not only to be a mentee, but to also be a mentor. Like I said, you are not just a consumer. The things that you are learning, the things that you've experienced, you can also be a mentor to somebody in medical school, in high school, who is interested in something you are interested in. It could be medicine, it could be outside of medicine. But as you continue to give back, like we saw, the effect is a ripple effect. And then an elevator pitch can be helpful for people who hopefully you find it useful. Okay. So I wanted you to share your key takeaway points, but again, the Slido is not working. References here, and any thoughts or suggestions from your own experiences as young professionals with mentor-mentee relationships. Is there anything that you want to share with your colleagues? Okay.
Hi, so I have a personal anecdote. I was a younger undergraduate teacher in the clinic, and I used to see the fellows in the elevator anytime I'm coming down. The long hour was the Hilton building. So I was there as a summer intern. And the reason I'm saying is that sometimes it's also important to create a connection. And being there and being a Ghanaian, it was easier for me to approach him. Because I remember I stood there with him, he said hello to me every time we met. We seemed to come down at the same time in the afternoon, and I never gathered the courage to ask him. So I saw his name, and I went to do some research about him, and I found out he was Ghanaian. And it was very nice. It was much easier to approach him. So the next time, in the elevator, so I told him, hey, my name is Felix Washiantiman. I'm also a Ghanaian, and I'd like to know more about you and hopefully be my mentor because I'm a pre-med student, right? And I ended up joining APM as an undergraduate, coming to APM conferences, even if I went to medical school, right? And here I am. So I think it's always important to gather courage and also create a connection. Very helpful.
Any other questions or additions? Otherwise, I'm happy to.
I just want to sort of echo a little bit what Felix said. Sometimes it really does take courage. You look at somebody as just completely unapproachable, so far beyond you, so like how can I even speak with them? And for me, as somebody who trained in pediatrics and then emergency medicine, I didn't have a lot of like some of the network of other trainees that people who do a pediatric emergency medicine fellowship get by doing that training. But there was an individual who was very well known within hearing at a conference. And finally, after one of these conferences, I just went up to her and I just said, "Can I talk to you? I don't know anybody in this field. I really want to get involved." And I even said, "I feel sort of like the awkward young boy asking the head cheerleader." I don't know if that's the same way here in Ghana as it is in the United States, but you know, to go, not to go on a date, but just to talk to me, you know, and just came at it with that level of like awe and just like eagerness, and it really, that one conversation opened up so many opportunities that have carried through for decades now. And so take the courage. The worst they can say is no, not interested, too busy. But sometimes you'll be really amazed at how much somebody will be willing to invest in you as an eager, awkward, young, non-popular boy.